Hi, my name is James. I'm a knee, foot and ankle specialist, and today we're going to talk you through everything got to do with sural nerve pain. Included in that is going to be the anatomy, the causes, symptoms, and we're going to go through the treatment for the condition, including some of the exercises that you can do, which is primarily known as sural nerve glider. So first of all, what is the sural nerve? Well, it's a branch of the sciatic nerve that splits behind the knee, and it provides touch, sensation, temperature awareness, information about vibration, and sensitivity to where your foot is in space. As the sural nerve is quite a superficial nerve, meaning that it's close to the surface, it's quite easy to irritate it. So typically things like ankle sprains, wearing tight-fitting shoes, tight-fitting ski boots are likely to cause inflammation of the nerve and present us with symptoms, which are normally pain along the outside of the ankle and down along the outside of the foot. The difference between sural nerve pain and typical tendon pain that we get maybe in the outer ankle is that it's often there all the time. Normally with a tendon pain it comes and goes depending on their activity levels, but with sural nerve it can be irritated by activity levels, but typically you get a low level pain that stays at rest or even at night. We often find that patients describe sitting for long periods of time, especially if they're driving a car on where their affected foot is just using the accelerator back and forth consistently. That can really flare it up and cause quite a lot of pain. Common conditions that it's often misdiagnosed as is peroneal tendonitis, a peroneal tendon tear, a lateral malleolus fracture, a fifth metatarsal fracture, a lateral ankle sprain, or an Achilles tendinopathy. So, how do we diagnose this condition? Well, clinically we should be able to do this, trying to listen for key differences between a tendinopathic presentation and a nerve presentation. Clinically we can carry out a Tinel's test, so that's tapping on the nerve on the outer aspect of the ankle. Normally we'd expect symptoms of tingling and pins and needles in the foot. We can try a modified single leg raise test, so that's placing a bias towards the sural nerve. Usually this is sufficient to begin a treatment process, but in some cases you might like to refer onwards for some imaging. It can be difficult to pick up anything on an MRI scan. Often you might use an ultrasound scan, which is quite good for superficial conditions like this, and you can also perform it live, so you can move the nerve back and forth and see if there's any levels of inflammation in or around the nerve. For sural nerve treatment, we need to look at some of the key causes. So if that's footwear, we need to have a discussion with the patient around what might be causing irritation on the outer ankle. Sometimes a therapist might like to try some manual therapy, so that might be mobilizations of the fibula head, it might be soft tissue work to the soleus and the gastrocnemius muscle. But the main thing that we tend to find is helpful is a sural nerve glider. So as you can see from the video, you bring your knee up to 90 degrees, straighten your leg up as much as possible, and when you get a stretch on your foot, you just turn it in and out while you floss the nerve. Normally we'd recommend to do 3 sets of 12, 2 to 3 times a day. Just be careful, you can overdo this and irritate the nerve a little bit, so sometimes beginning with once a day is helpful and then building from there. In most cases this is sufficient to alleviate symptoms over a period of 2 to 4 weeks. Unfortunately, in some cases where this doesn't work, we might refer on to one of our colleagues, such as a sports medicine doctor. They could look at things such as an ultrasound guided steroid injection to help settle down the nerve. Sometimes you get a bit of a steroid flare for this for 1 to 2 weeks. Normally things then settle down and improve, and then we progress back on physical therapy, and most patients resolve their symptoms from this point. So all in all, that covers the tricky condition of sural nerve pain. If you've got any questions, please leave them in the comment section below, and if you found the video helpful, please like and subscribe to our channel.